So we know that sciatica is one of the most common and most debilitating conditions out there. So let's go through some ideas for how you can treat sciatica in practice. Let's dive in. Hey guys, Khalid here. Welcome back to Clinical Physio. So in this video, we're going to dive into some of the key ways in which sciatica can be treated in practice. And we're going to break this down into 4 key components: education, exercises, adjuncts, and non-conservative measures. So first of all, education. This is probably one of the most important things that is so overlooked. We know that sciatica can sometimes be due to a general increase in sensitivity in the neural system. Therefore, how can we dampen this down? One of the key ways is reassurance. Introducing desensitivity to the nervous system by making your patient desensitized. Reassurance by explaining to patients that commonly sciatica symptoms do get better, and the majority of patients do improve their symptoms within 12 weeks. We can also highlight that there are key things that they can do to dampen down the system themselves, including taking painkillers, consulting with their doctor to make sure they've got some nerve-based pain medication to help them. And we know that relaxation, by doing things like mindfulness or relaxation techniques, also helps to just reduce sensitivity of the system as a whole. And we can help to reduce anxiety by tackling those scary terms. When an MRI scan comes out saying that your patient has degenerative disc disease, we can try and explain that this can be a normal finding in people without any pain at all. So it doesn't have to mean anything significant in terms of their MRI. Also, we know that bed rest is no longer a good option for these patients, and instead, gentle movement within what's tolerable for them over the first 6 weeks is really important. In fact, evidence has shown that when it comes to specific physiotherapy exercises versus gentle or aerobic activity, there's no major difference between the two. So we would commonly say, what does your patient prefer? Specific structured exercises or just general movement and activity? Whichever they prefer is the best for them. So concept number 2 is exercise. Now, as we just said a second ago, that exercise might simply take the form of general movement and aerobic exercise. If that's what your patient prefers, brilliant. Don't stop them and say they have to do specific structured exercises just because it helps you be a better physiotherapist. Whatever suits them is the most important. And of course, if it helps them become more confident because they enjoy swimming and they can go back to swimming, all the better. Now, if they do want specific structured exercises, of course, there's loads of options we can give them. And it may depend whether or not your patient is more comfortable in a flexion movement or an extension movement, for example. So in a situation where your patient prefers flexion or more bending-based movements, then we can try and encourage exercises along those lines. For example, here is a prayer stretch, which naturally will get lumbar spine moving and into a flexion position to help them. We can then gradually progress this into lumbar spine flexion in a sitting position. And if this becomes more comfortable, we can even get them to do it in standing, perhaps by using a chair or even by doing it without any support at all. And of course, we can progress this into a full gym exercises like a deadlift exercise once they get further down the line. If your patient prefers extension-based movements, we can do that too. We can get them lying in a prone position doing something like a cobra stretch. We could get them to do extension in a standing position. Or, when they're further down the line, we can get them doing exercises with weights such as squats or a sit-to-stand movement or even something like a hip thrust movement, all of which are going to gradually encourage extension. Now, here's a news flash. I'm sure you've seen videos online that will say things like, here is the best exercise for sciatica, or here is the number 1 exercise that will cure your sciatica. I hate to say it, there is a little bit of fake news attached to these ideas. How can there be just one exercise that works for every single patient on the planet when it comes to sciatica? The reality is, as physiotherapists, we need to be better than that. We need to analyze our patient and adjust the best exercise that suits them. That means going through a range of assessments, going through different exercises and working out what suits them. That is far more important. Or, as we said earlier, what general activity suits them best. That is most likely to be what suits them rather than one exercise that fits all. Now, within physiotherapy, we can also consider adjuncts. For example, it might be something like acupuncture, which can be sometimes used to try and help alleviate symptoms, particularly pain, and trying to generally reduce the amount of pain and sensitivity that your patient has to allow them to engage in more specific exercises. Some physiotherapists or some other clinicians might involve manual therapy as a way of doing the same. Ultimately, the evidence behind these adjuncts isn't perfect. Nothing is. However, it might be something that could be trialed if you believe in it and if you feel that it's useful for your patient. But one key thing to mention, don't hang your hat on these individual adjuncts. Your patient must always be aware that they also have a role in keeping themselves moving, doing exercises, whether that be general activity or physiotherapy specific exercises, to keep themselves going, rather than just focusing on the acupuncture as the only thing that will help them. Then we have other options such as non-conservative measures. For example, things like injections. Some clinicians or some orthopedic consultants might consider epidural injections as a way of trying to reduce patients' pain, particularly for those who have persistent symptoms. Some general rules of thumb: that individuals can have repeat injections if needed, but not within 6 weeks of another one, and only if symptoms improve by 50%, because that way we know it's truly worthwhile to do it again. And then the fourth and final concept, surgery. Now, in the majority of cases, this should be used as a last resort. However, there are some patients who might be a more immediate candidate for surgery. For example, if they have significant nerve root compression, which is leading to deteriorating sensation changes or deteriorating weakness within their legs, or for patients who are identified as having quadriquina syndrome, in which case surgery is an emergency. However, the majority of patients that will fit into this bracket are those who just haven't improved with conservative measures like physiotherapy within a 12-week program. So for individuals like this, an example of a surgery they could have might be a microdiscectomy. This is where a surgeon will remove the disc material that is compressing those sciatic nerve structures, but therefore retaining all the other structures that maintain stability and flexibility of the spine. These surgeries have approximately 75 to 90% success rate in alleviating radicular symptoms like sciatica, but only in the right patient. And of course, an orthopedic consultant should be consulted as to what surgery is best for that patient. So guys, I really hope this has given you some ideas for treating your patients with sciatica. If it has, please smash that like button and subscribe to the channel for all our best updates. Remember, we've got loads of resources on our Instagram channel @clinicalphysio and on our membership website, member.clinicalphysio.com, to help you be the best physiotherapist you can be. My name's Khalid. Thank you so much for watching. See you soon here on Clinical Physio.